So let's talk about diseases of the pleura. Now these other ones are going to be fairly small. Restrictive and obstructive, those are big. These are now relatively small. So the pleural cavity, between the visceral and pleural membranes, they're touching each other, but that's a potential space. We could put stuff in there, whether it's blood or fluid or air, but that's a potential space that could then compress against the lungs. It's very similar to what we talked about with pericarditis. If you put blood in the pericardial sac, it could press against the press against the heart, and now the heart is going to have problems filling with blood and pumping because something else is pressing against it. Similar over here. Now we have something that's pressing against the lungs, and it's going to make it very difficult for the lungs to expand. Okay? I don't know why I came up with that. So what we have over here is pleuritis. Pleuritis, also known as pleurisy, same thing. And what happens here, it's due to pneumonia, trauma, some kind of cancer or tumor, and you get this pleural pain. You're going to get this extra accumulation of pleural fluid that's going to go into that area, and it's going to, well, the two walls over there, the visceral and parietal walls, or membranes, they get thick, and they start riding against each other. They get thick because they're inflamed. And when they start riding against each other, they're going to have this friction rub. When you listen to the lungs, you'll hear like I said before, you step in snow, boom, boom, boom. Because you have these two membranes that are inflamed, and as they ride along each other, it makes this friction rub, but it causes a lot of pain. Any kind of inflammation is going to cause pain. So that's why they have, especially when they take a deep breath, or when they take a breath for that matter, it hurts because they're rubbing against each other, kind of thing. Okay? So you have this pleural pain. All right? Questions on that? Now, other things that that can actually go in that pleural space, we can put blood in there, and then we call it a hemothorax. All right? So if there's a stab in the chest, then the blood is going to pour into that space. More and more blood go in there, start compressing on the lungs, and now the lungs is collapsed. You can't expand it. You can also have a pneumothorax. A pneumothorax is that you're on a ladder and you fall off the ladder, and then you have a rib that actually went into the lungs, and now all that air is going to go into this space. Now, the problem is with this is that usually when this happens, the hole that goes in the lungs creates a valve, which means the air can leave the lungs, but it can't go back into the lungs. It is a one-way mechanism. And that's what happens a lot when you have these pneumothoraxes. Otherwise, the air would just go right back into the lungs and it goes out. But the problem is that it's difficult to do that. So the treatment for this is that we've got to remove that area, that whatever it is, blood, liquid, air. So we're going to put a needle in the lungs, or at least around the lungs, and drain out the area by putting a chest tube there. I'll show you the picture in a moment. It'll make sense. So let's look at this thing here, as in a pneumothorax. This is what it normally looks, and this is a very simple schematic view of a normal lung. Here's, let's say, the trachea that leads to the lung. Very simple. Then you have this intrapleural space, and then you've got the sac over here. So you have three things in terms of air, right? This is the alveolus or the lungs. So you have, in terms of pressure. So let me go into this picture. You have pressure in the lung, you have pressure in the intrapleural space, and then you have the atmospheric pressure. The atmospheric pressure is always going to equalize with the intrapulmonary space or the lung itself, right? We always got to have a difference over here. Otherwise, you're not going to have breathing. For instance, if this is 0, which matches the atmospheric pressure, right? It should match. When you breathe in, that's what's coming in. This is going to be higher than the intrapleural space, the pressure here. So this would be 0, this would be -5. So therefore, this is able to expand because it'll go down, it's going from a high pressure to a low pressure. Does that make sense? Right? Well, look what happens if you puncture this. Now, when this gets punctured, then we're going to equalize, this intrapleural space is going to equalize with the atmospheric pressure. Because now you just made an opening there. So now you have 0 here, 0 there, and the air that's coming in here is 0. So there is no gradient, which means that this lung is not going to open because it's equalized with the pressure out there. Does that make sense? Right? That's what's happening with this. That's why a pneumothorax, this extra air that got in here, is not going to make that lung expand. So a pneumothorax causes a lung to collapse. So we got to get that air, we got to close this and then get the air out of there so we can put it back. So this is a hemothorax. This is going to be loaded up with blood, pressing against that lung. The lung is going to collapse because it can't get air into it because something else is holding it from expanding. A pneumothorax, all the air goes around here and it's compressing against the lung. The lung, like I said, that air is either going to be the pneumothorax in the sense that you saw before, where it's going to equalize here, or that pneumothorax is because of that newly created valve. The air can go out, but it can't go back into the lung. That's another picture of a collapse, a pneumothorax, where the lung gets collapsed. Okay? So what do you do in a case like this? You have the person lean forward, and what that's going to do is make the ribs go further apart from each other, so you have more of a workspace to work there. Does that make sense? Where you're going like this, the ribs go further apart. Okay? And what you do is you put thoracentesis. You put a needle in here at the lowest area. You take the needle out, put a chest tube there. So now you're putting a tube that leads to a bag. Now if there's fluid or blood in there, all that will go into the bag. If it's a pneumothorax, we got to get rid of all that air out. So you will have a bag full of water here that we put in before we do the chest tube. You put water here, and then all the air will come out, and what will we see in the water? Bubbles. Yeah. Okay? So once we see no more bubbles happening in here, then they're going to be fine. That could take like 7 to 10 days. So that's how we correct that. Okay? Questions on that? Mesothelioma. Oops, sorry. Mesothelioma. Lung cancer? Lung cancer? What do you think? No. Not lung cancer. Please get that out of your head. All right? A lot of times the TV kind of misleads people. Okay? It is not lung cancer. It can lead to lung cancer, but it's not lung cancer. Mesothelioma is a rare cancer, okay, that affects the parietal and visceral layers. That's what becomes cancerous. Now, keep in mind, parietal and visceral layers, where do you see that? Where else would you see that? You see it just in the lungs? No. The pericardium. You also see it in the abdomen. See it around the testicle. So, technically speaking, mesothelioma is not just around the lungs. You could have mesothelioma also occurring in the testicle, in the abdomen, in the pericardium. You see it a lot more in the lungs because of what a risk factor is over here, which I'll talk about. Okay? But understand, mesothelioma is not lung cancer. It's wrong. It is not the #1 cause of cancer deaths in America. Mesothelioma is not there. It's a very rare disease, a rare cancer. So, risk factors is chronic exposure to asbestos. Now, about 5 years ago I've been asking this, but I didn't realize this. Who here knows what asbestos is?
Isn't it in like the walls, like of old buildings?
Well, what is it? What is it there for? What is it there for?
Insulation.
Yeah, fiberglass. Okay, so what it is this. All right, you all have different ideas.
It's not that pink stuff.
No. That's fiberglass. No. They don't sell asbestos anymore. Asbestos, you have parts of it all here. Okay, fire. I see where you get. So asbestos is a substance that doesn't catch on fire. Okay, it's a synthetic thing that doesn't catch on fire. So in the 1920s and 30s, a lot of houses were had asbestos in the plaster, and they kind of built houses with this asbestos. Why wouldn't you? This doesn't catch fire. Therefore, your houses won't catch on fire. Hey, it's my idea to make American flags made of asbestos. You don't have to worry about burning the flag. That's supposed to be a joke. Okay. Anyway, but that's what happened. So in the 1920s, but now we saw people living in these houses for 30, 40 years. Well, what was happening is that little particles of asbestos was entering the air. It was breaking down and going into the air. So now they're breathing in this asbestos. Then we started realizing that they were getting these odd kind of cancers, mesothelioma. That's what's happening.
Not only, that's not like they were just floating in the air, that's what you disturb unless you try to do something.
Yeah, but as the house settles and stuff, I mean, there's a lot of things that go on. If there's like bracket, you know what I'm saying? It starts breaking down.
If you leave it, you don't touch it, it's fine.
Right.
If you disturb it and try to
Exactly.
it becomes a health hazard.
Yes, and that's why we have a lot of houses and school buildings that are still made of asbestos. Yeah. But legally, when they sell the house, they have to tell the next person that there is asbestos in there. And it's up to them what they want to do. Okay? Schools, I still think they're supposed to tell you that there's asbestos there. Okay? Well, I don't know. No, I'm not saying this school has it. But yeah, you're right. If it gets disturbed in some way, but you can never plan for that. If the house settles, that can also cause some of the asbestos. You're living around a lot of, cancer-infested areas, right? That kind of thing. So that's what asbestos is, okay? So at least you have some idea what that's all about, all right? So the pleura is the most oftenly affected because of this asbestos. That's why we see mostly mesothelioma in the lungs. Not in the lungs, but the coverings of the lungs, okay? That's why we see it more often there. But do keep in mind that it's also in the pericardium, it's also in the testicle, and the peritoneum, right? Wherever you see visceral and parietal layers, that's what you'll see, okay?